Health and care professionals are involved with patients and clients at some of the most challenging and inspiring times of their lives. Retaining compassion and empathy and imagining what it is like for each patient and client at every encounter is not as easy as it sounds. And over time, research tells us that empathy and compassion can become eroded, and staff can become detached and burnt out. All health and care professionals may, at some time, need to process some of these encounters, and may require support to reflect upon the social, emotional, and ethical aspects of their work. What it felt like for them to be in that situation, to disagree with colleagues, to feel unsupported with decisions they have taken, to feel helpless in the face of aggressive disease, or difficult and tragic circumstances. All health and care professionals are exposed to these potential challenges, often on a daily basis, and sometimes it is a struggle to keep going. It is common to feel a sense of responsibility, anger, helplessness, sadness, and sometimes guilt. To keep going, such professionals find ways to protect themselves. Yet, to deliver compassionate care, staff need to keep in touch with their own humanity.
Schwartz rounds were set up to support staff to do this. They offer staff time and space in a busy, fast-paced environment to come together to discuss openly and honestly the ethical, social and emotional aspects of their work. So how do they work? Drawing on over 2 years of research, uniquely we've identified 4 stages to rounds. Some of these go on behind the scenes. The first stage is identifying organisational stories and relevant panellists. Schwartz rounds offer staff a chance to share their stories and be heard. Crafting these stories begins in panel preparation. A skilled facilitator hears a raw, uncut version of what happened and uses careful questioning to identify the key aspects of individual stories that might resonate with colleagues. Together they distill this into a 5-minute story to be shared at the beginning of the round, engaging listeners through emotions and connecting people to a story that triggers reflection and situates staff experience centre stage. Good panel preparation helps panellists decide what and how much to safely share, and how to tell stories that resonate, paint pictures, and transport listeners to a scene.
There were lots of reasons why we offered our story as a round, but not least that we thought others could learn from it. It was about the discharge and safeguarding of an older gentleman in a complex family situation. During the preparation, the facilitator helped shape our story. We had to meet with her 3 times because the story was so complex. She helped us understand our roles in the case, draw out the main themes, clarify. Basically, she gave the whole story a structure, drew on all of our separate and different experiences so it made sense and could resonate with others.
It was a very safe and supportive environment, and we knew anything we said would be treated confidentially. The facilitator helped us name the emotions we had been feeling. I think that normalised it. It made it okay to talk about how we felt at the time, how we still felt. None of us had realised how much of an impact it was still having on us. The preparation and round itself took place about a year after the case. If it had been straight away, the emotions would have still been too raw. There would have been too much anger, too much anxiety.
I experienced an upsetting incident while on a home visit. The facilitator asked me to really focus on how the event impacted on me. She knew that there would be a lot of people who work in the community at the round. Lone workers working without the backup of a team, and some of them would have experienced scary incidents like that, and she thought this story would resonate with them.
We were a team who worked together and had all been through this ordeal. We were close and supported each other. The facilitator recognised that and brought those relationships out in the story. Preparing together was so important. I realised that I wasn't alone in how I felt. Others were feeling it too. Mr. Gonzalez was living in temporary accommodation when he was admitted. If he didn't go back there, his 2 sons who were living with him thought that they would be evicted. But we had real concerns about his safety if he returned there. He needed a lot of help with washing and dressing, and his mobility was really poor. We were also increasingly aware of a safety risk from his family. He had 2 sons in their 20s. They were always on the ward. They were noisy, would disturb other patients and visitors. They would sabotage equipment. They even stole pillowcases. Mr. Gonzalez seemed withdrawn and intimidated when they were there. They would stop him trying to speak to staff. His sons gave us a lot of incorrect information about him. They said he was completely independent before admission, which we later found out was false. They argued against our assessment that Mr. Gonzalez had no capacity. They felt he did. One of his sons was getting a carer's allowance for looking after him, but there was evidence of neglect. There was just so much uncertainty and a lot of inconsistency in the story. We weren't even sure that they were really his sons because of the huge age gap. We didn't know what they wanted, what their agenda was. It was really very stressful. I managed several of the therapists who were caring for Mr. Gonzalez and could see it was getting to them. I tried hard to support them, but worried that I didn't do enough. I was with Mr. Gonzalez one day and one of his sons called him. He passed the phone to me and his son said, "I know where you are. I can come and find you." It was frightening. It was very frightening. I was scared to go home after that. I asked a colleague to walk me to my car. It upset me for days afterwards. As a result of the son's behaviour, we raised a safeguarding alert. They hired a lawyer and we started getting emails saying we weren't acting in the patient's best interests. Eventually, the trust's legal team got involved.
Mr. Gonzalez was one of my first patients following qualification. Communication with him was very difficult. He refused to engage with interpreters and we didn't trust what his sons were translating. I spent many hours assessing his communication and cognitive capacity. I felt guilty because I felt like I was neglecting other patients. I just didn't have time to see them. The case was difficult and stressful, but we all cared about Mr. Gonzalez so much. As he got to know and trust us, his sense of humour came out. He had an expressive face and a strong personality. He used to play tricks on us, hide things. He made us laugh. He brought out our tenderness and we wanted to protect him. Then the legal team got involved. I was petrified. My work was under a microscope. A lot of how the case was progressing was based on my assessment of his communication and capacity. The lawyers picked through my notes with a fine-tooth comb. I felt vulnerable and under scrutiny. I really doubted myself and anticipated criticism from them. It was such a stressful position to be in so early on in my career.
I went to Mr. Gonzalez's home with a rehab assistant to set up his flat for discharge. There was a knock at the door, I opened it, and 2 police officers pushed past me and went inside. They were looking for one of the sons and asked me if I knew where he was. He was out at the time, but his brother was upstairs. I told them what I knew, but I was so scared that the son, who was at home, would overhear me and be angry with me for saying the wrong thing. I felt so vulnerable and out of my depth. I didn't have the backup of more senior colleagues and I was scared. I went back to the hospital and told the other therapists. They were all shocked. It stayed with me for a long time. In the end, the Council on Social Services decided Mr. Gonzalez was not at significant risk from his sons and that it was safe for him to go home, despite our recommendations to the contrary. So we waved goodbye and he left. We asked for an update on how he was doing, but heard nothing back. I felt angry they decided that he was not at significant risk from his family. I felt that my professional opinion was being undermined, but we had to let him go. Personally, I felt I'd let him down. We all put in a lot of effort, but didn't manage to protect Mr. Gonzalez, didn't manage the aggression of his family. It was hard to let go.
What an amazing job you did. I feel sad hearing that story, but the patient was lucky to have therapists who cared for him so much. You really went above and beyond.
I was involved in a similar case. It was a long time ago, but I can still remember exactly how I felt. You did a great job of supporting each other. It's important for us to protect patients, but we need to be there for each other as well, because things don't always end the way we'd like, and that's difficult to accept.
Good facilitation and the creation of a safe space supports staff to disclose stories revealing difficult, demanding and satisfying aspects of their work. When staff show their human and vulnerable side, it breaks down barriers and creates a level playing field for all staff. The group interaction and hearing multiple perspectives creates recognition of shared experiences and feelings, providing greater insights into patient, carer and staff behaviours. Rounds shine a spotlight on hidden organisational stories and roles and provide opportunities for reflection and resonance so staff can make sense of their experiences at work. Rounds have a cumulative effect. Over time, a Schwartz savvy audience develops who can support the facilitator to ensure safety and containment, build trust and a supportive community. Staff who attended rounds reported having increased empathy and compassion for colleagues and for patients, reduced feelings of isolation, and improved teamwork and communication. At the beginning of our study, a third of staff in our survey reported poor psychological well-being before attending any rounds. When we resurveyed the same group 8 months later, there was little change in staff who hadn't attended rounds. However, in staff who attended rounds, the proportion with poor psychological well-being had halved. While Schwartz rounds do not set out to solve problems, we identified examples of changes in practice, such as the revision of protocols based on rounds discussions. Rounds offer a unique countercultural space where staff experience is the priority, emotional disclosure is encouraged, and staff support and listen to each other without judgment. In this space, hierarchies are flattened, defences are left at the door, and humanity is revealed.